Have you ever felt this pain tormenting you? When walking, climbing stairs, or even just sitting down, your knees can be painful and uncomfortable. Oh, my knee hurts so much. This may not only be a normal sign of aging activity, but also a warning of a dangerous health problem. And you are not alone in this. According to the American Arthritis Association, more than 31 million Americans are living with osteoarthritis, one of the main causes of knee pain. And if you are over 70 years old, there is a 40% chance that you will have this problem. This means your knees may be under a lot of pressure without you even realizing it. Linda, 68 years old, is a very active woman. Every morning she often gets up early to take care of the garden. But recently every step she takes makes her feel heavy. Her knees seem to have no strength left. She thought it was just old age, but when she saw a doctor, she realized that this could be a sign of an illness that required bubbling. Linda's story is not hers alone, but the story of many of us. So do you know any signs that your knee pain may be causing you more weight than you think? Join me to learn about signs you can't ignore and simple ways to keep your knees healthy. The problem we're talking about today is knee pain, one of the most common causes of inconvenience in the daily lives of the elderly. Knees are not just simple pain, but a sign of more obesity problems such as arthritis, rheumatoid arthritis, or even storm disease. For the elderly, this pain can have a profound impact on quality of life. It reduces your ability to switch, causing you to skip favorite activities like walking, strolling around town, or even simple tasks like going up and down stairs. And this problem is not just a passing pain. If not treated promptly, headaches can lead to fit variations, loss of ability to care for yourself, or can even increase the risk of falling, causing serious injury. A recent study by the Thurston Arthritis Research Center showed that knee pain not only affects movement, but is also associated with higher mortality rates in people over 45 years of age. In this video, you will learn 5 warning signs that your knees are degenerating, helping you identify problems early before they become serious. In addition, I will share 7 simple but effective solutions to help reduce headaches and maintain pillow flexibility, thereby improving quality of life and reducing the risk of complications. If you apply this information, you will not only make your knees stronger, but you will also be able to regain the activities you love, albeit limited, such as going outdoors or even participating in picnics with friends and family. Watch the final video to see what important strategies you can apply today to keep your knees healthy and flexible. Currently, we will talk about a very common and frequently encountered problem when entering adulthood and old age: osteoarthritis. Did you know that arthritis is a cause of knee pain in people 60 years of age and older? And the important thing is that most of us don't realize how dangerous the disease is until the pain becomes unbearable. Arthritis occurs when the protective cartilage between games wears away over time. This causes the bones to rub directly against each other, causing pain and stiffness. With age, the ability to regenerate cartilage gradually decreases and arthritis becomes a very common problem. The mechanism of action is very simple. When the joints, especially the knee joints, no longer have a protective membrane, they will rub against each other when moving. This causes pain, scratching, and sometimes strange noises when you move. Wear and tear is a natural process as muscles age, but there are a number of factors such as weight, previous injuries, and movement that can speed this up. A study conducted by the American Arthritis Association indicates that approximately 31 million Americans have osteoarthritis, and this number is increasing as people age. Also, according to a study from the Arthritis Research Center at the University of North Carolina, people with arthritis may find a higher risk of other fat health problems, such as low back pain, and even a higher mortality rate if not treated properly. Arthritis does not cause pain but can lead to depression and reduced quality of life, especially when the patient does not recognize or treat it promptly. Have you ever felt pain when waking up in the morning or after sitting for a long time? This may be an early warning sign of arthritis that you should not ignore. Next, we will treat rheumatoid arthritis, an autoimmune disease that not only affects matches but can also impact other parts of the body. Inflammation occurs when the body's immune system goes haywire and attacks healthy tissue, causing inflammation, thickening, and inflammation. This is a chronic disease which can lead to consistent variations and reduce the sufferer's quality of life. What's special is that rheumatoid arthritis not only affects the joints, but can affect other organs such as the skin, eyes, lungs, heart, and blood vessels. Simple mechanism of action. When the immune system is too active and attacks mechanical tissues, it is not dangerous in the joints, especially in small joints such as fingers, wrists, and knees. This makes the matches painful, predatory, and hard matches. As inflammation continues, it can lead to complex junctions, causing deformity and reduced mobility. According to a study from the National Institute of Arthritis and Osteoarthritis, rheumatoid arthritis is not just a joint disease, but also a systemic disease. Researchers also point out that rheumatoid arthritis can lead to other serious problems such as cardiovascular disease, lung problems, and even protective disease. The disease is especially dangerous because its symptoms can appear and disappear in stages, making timely detection and treatment more difficult. For the elderly, comprehensive health monitoring is very important. Regularly check for signs of illness not only at your home, but also at other facilities. If you feel any pain, do not hesitate to see a doctor for timely treatment and expectation. To keep an attack of rheumatoid arthritis in check, the most important thing is to start treatment early. You can consult your doctor about treatment options, including anti-inflammatory medications, pain relievers, and dietary modifications. A balanced diet rich in foods rich in omega-3s like salmon or chia seeds can help reduce inflammation. Additionally, light activities such as walking or yoga can also help improve joint mobility and reduce stiffness. Have you experienced symptoms such as heat and pain during many matches at that time, especially in the morning? This may be a sign of rheumatoid arthritis that you need to pay attention to. We talked about arthritis and how it affects the knees. Now let's learn about another health problem, which is also common and not dangerous, which is bursitis, a disease that can directly affect your ability to function. Bursitis is a condition in which small, fluid-filled sacs, called bursae, surrounding the joints become inflamed. These service activities help ease surveys and protect their proper operations. When the bursa becomes inflamed, it will cause pain and difficulty in transition work. When the bursa becomes inflamed, the cushioning that protects the joints is reduced, making the joints more difficult to move. Inflammation can occur when repetitive or traumatic movements cause stress. This causes pain and limits range of motion. Besides, bursitis does not only occur in large joints such as knees, broken hands, or hips, but can affect small joints such as fingers and toes. For example, bursitis in the knee can make it difficult for you to walk or even simply last for a long time. Not only that, bursitis can increase the risk of other diseases such as arthritis or fever if not treated promptly. Therefore, identifying and treating bursitis early is important to avoid long-term complications. More importantly, when the elderly experience bursitis, timely treatment and application of supportive measures are extremely important. Maintaining gentle movements, avoiding impact that puts pressure on the game, and using knee pads can help reduce pain and increase mobility. Do you often feel pain in your knees after performing repetitive movements such as kneeling, squatting, or climbing stairs? This may be a sign of bursitis that you need to pay attention to. We have learned about bursitis, but another disease that the elderly are very likely to encounter, and many of us often ignore, is inflammation. So what is fever, and how to recognize its first signs? Inflammatory disease is a form of arthritis that occurs when uric acid accumulates in the blood, forming crystals in the joints, causing dangerous redness and pain. The special thing about fever is that the pain can come suddenly, especially at night, making the affected area such as the big toe, ankle or knee so hot and sensitive that just a gentle touch is enough to cause pain. When the body produces too much uric acid or cannot remove it properly, uric acid reconnects and forms crystals in the joints, causing inflammation. These crystals are similar to sharp stone fragments, impacting surrounding tissues, causing severe pain, especially when there is a sudden change in diet or lifestyle. On that shore, survival is frequent, with pain lasting for days or even weeks. If not treated promptly, the disease can lead to a distant outlook on the game, reducing mobility and quality of life. Not only that, when the cyclone becomes chronic, the pain can recur more often, causing difficulty in performing daily activities, such as walking or climbing stairs. Furthermore, pace sickness not only affects matches, but can also work badly with other facilities in the facility, including careful components. More importantly, some studies show that response is closely related to diet and lifestyle habits. For example, consuming too much purine-rich foods, such as red meat and seafood, or drinking alcohol can increase your risk of shingles. In addition, maintaining a healthy weight and avoiding foods high in sugar also play an important role in reducing the risk of developing the disease. Have you ever experienced sudden pain, anger at the game, accompanied by something red and hot, especially after eating a lot of red meat or seafood or drinking alcohol? This could be a sign of malaria that you need to pay attention to. We also learned about diseases that can harm the game and affect the quality of life of the elderly. However, one of the most important factors to help prevent and treat this disease is maintaining a healthy lifestyle, especially through maintaining physical activity and a reasonable diet. So, how can we protect our game and stay active when activity is increasing? Explanation of how it works. When we exercise, muscles are trained and strengthened to support matches. Maintaining physical activities such as walking, swimming, yoga, or gentle exercises helps improve game performance and endurance while reducing stress and pressure on them. Reduced physical activity also helps increase blood circulation, helping nutrients and oxygen reach the game and surrounding soft tissues. According to a Harvard University study, staying physically active can help reduce the risk of joint diseases, including osteoarthritis and osteoarthritis. Dr. Julie Miller, an expert in geriatric healthcare, says that gentle exercises like walking, cycling, or yoga can help relieve pain and improve joint function, even for people who have had bouts. Additionally, research also shows that a proper diet with adequate amounts of vitamin D and calcium is important for maintaining bone and joint health. A study from the Journal of Clinical Nutrition found that supplementing with products rich in omega-3 and vitamin D can help reduce inflammation and slow the aging process of joints. Have you tried adopting a healthy lifestyle with a balanced diet and exercise? This could be the key to helping you relax and improve your knee problems. After reviewing the signs and symptoms of arthritis, bursitis, rheumatoid arthritis, and patellofemoral pain syndrome, do you feel you may be experiencing any of these conditions? Arthritis. Do you often have pain and stiffness, especially after exercise or when waking up in the morning? Bursitis. Do you feel sore during matches after performing repetitive movements or doing daily tasks such as kneeling or squatting? Claw disease. Have you ever had sudden pain accompanied by fever, redness, and heat in a match, especially the big toe or other matches? Rheumatoid arthritis. Do you feel tired, hot, and sore during matches, especially in the morning or after a long rest. Patellofemoral pain syndrome. Do you feel pain in the front of your knee, especially when climbing stairs, squatting, or kneeling? Leave a comment with the corresponding number if you find yourself looking for any of these signs. In the next video, we will analyze these conditions in more detail and share effective solutions to help you improve your health and quality of life. Together, we learn about the joint pain and discomfort that the knee can experience, from arthritis, bursitis, rheumatoid arthritis, and patellofemoral pain syndrome. These problems not only affect the ability to move, but also reduce the quality of daily life. But don't worry, because right now you will have access to simple but extremely effective solutions to protect and improve your strength. Let's explore 7 solutions to keep your knees healthy, from maintaining an ideal weight, strengthening muscles, stretching flexibly, simply choosing the right sandals, checking decorations, supplementing nutrition, to using protection packs. These solutions are not only closely linked together but also create a comprehensive care regime, helping you maintain your fitness and enjoy life every day. To protect your knees and minimize pain, it's important to maintain a healthy weight. Each kilogram puts extra pressure on the joints, increasing the risk of osteoarthritis. Research from the American Arthritis Research Society shows that maintaining an ideal weight helps keep weight off during matches, and research published in the Journal of Clinical Nutrition also shows that weight loss can improve motor function and reduce pain. How to maintain a healthy weight. Here are 3 simple steps. Monitor your weight regularly, once a week. Eat a balanced diet with lots of green vegetables, fruits, and whole grains. The results are gentle exercises like walking and swimming to burn excess energy. What methods have you tried to maintain a healthy weight? Please leave a comment below. Once you learn about weight maintenance, move on to exercises to strengthen your muscles, which will help protect your head from injury. Muscle strengthening exercises, especially the thigh and adductor muscles, help stabilize joints and reduce the risk of pain during movement. Research from Harvard University has found strength training improves the ability to support physical fitness, while Dr. Julie Miller, a senior healthcare expert, recommends light exercises like walking, cycling, and yoga to maintain match fitness. Here are 3 simple exercises you can do at home. Straight leg raises while sitting on them, 10 times each leg. Stand up and sit down from a position without using your hands, 10 times. Walk in place for 5 minutes, 3 times a day. You should start with simple exercises, increase intensity, and monitor your conditioned body, thereby concluding that maintaining heavy weight with muscle strengthening is an effective way. What exercises have you tried to strengthen the muscles that protect your knees? Please share your experiences. Next, stretching plays an important role in maintaining flexibility and reducing stress after exercise. A study published in the Journal of Sports and Medicine found that pre- and post-workout stretching exercises help extend range of motion while also reducing pain. Physical therapists at the American Academy of Physical Therapy also recommend that regular stretching will help the muscles around the head relax and recover. Here are 3 simple stretching exercises you can do every day. Stretch your front thigh muscles. Stand straight, bend one leg back, hold for 30 seconds. Stretch your hamstrings. Sit on the saddle. Sit with one leg forward, lean forward, hold for 30 seconds. Stretch your calf muscles. Stand in front of the wall, 1 foot behind you, Gothic foot close to the floor. Hold for 30 seconds. You can spend 5 to 10 minutes before and after each workout, doing gentle stretches for your calves and muscles, making sure that the intensity is not too intense and causes pain. Which stretching exercises have you tried and found most effective? Please share in the comments. Besides, wearing shoes that fit well and have enough support is also important. Research from the Movement Research Institute shows that ill-fitting footwear can increase pressure on the knees, causing postural jerks and increasing the risk of injury. Orthopedists advise that shoes with soft soles and good arch support will help improve walking style and reduce pressure accordingly. When choosing shoes, pay attention to 5 important characteristics. Count on soft shoes with good resilience. Proper, angle support stable shoes, not too high, wide enough at the finger-light weight, easy transition. Please choose shoes that fit your foot size and, if necessary, use shoe cushions or insoles to increase comfort when moving. So how to combine the right shoes with exercise? Choosing good shoes is important steps to protect your knees when exercising and in everyday life. What type of shoe are you using and how does it support your knees? Please share your experiences. Next, consider the importance of checking your attire and posture when walking. Correct walking and posture not only help you move effectively, but also help distribute strengthening forces evenly, minimizing the risk of injury. Research from the Orthopedic Institute has proven that poor walking style can cause chronic joint problems, and experts from the University of Medicine confirm that improving walking posture can reduce knee pain by up to 30%. Here are 4 principles to maintain the right style. Hold zoom, relax forward, not outgoing. Walk naturally, not too long or too short. Place your heels down first, then roll to your toes. Always. Refrain from walking naturally and avoid steps that are too long or too shaky. If necessary, you should consult your doctor or style expert for specific advice. Have you ever realized there's something wrong with your style? Please share how you improved it. Not only that, take supplements like glucosamine, chondroitin, and MSM, which are also important ingredients in supporting meat function and reducing pain. A study in the Journal of Functional Medicine found that people who took these supplements were able to reduce osteoarthritis symptoms and improve joint function. In addition to supplements, you should also increase your intake of products rich in natural anti-inflammatories. Fatty fish, salmon, mackerel are rich in omega-3. Turmeric contains curcumin. Ginger contains gingerol. Berries are rich in anthocyanins, pure olive oil. However, before starting to use any supplement, you need to consult a reasonable doctor to determine the appropriate amount and choose a product with a clear origin. What foods or supplements have you tried to improve your fitness? Please share your experience. More importantly, last but not least, is to wear knee guards. Research from the Sports Research Concussion Research Institute shows that using knee guards or braces helps reduce pressure and the risk of injury, especially during vigorous activities or when you have to do it for a long time. There are different types of knee protection packages to suit each need. Elastic knee bandage provides lightweight support, enhances stability. Knee protection belt, medium support, helps stabilize the game. Knee brace, strong support used when injured. Head pad, protects when kneeling or hitting hard. Orthopedic experts claim that a properly designed knee pad will help improve posture and protect the foot from unwanted impacts. Please choose products that are appropriate for the size and shape of your knee and use them in active equipment as needed for natural motor support and temporary pain relief. Have you ever used knee guards? Which type has helped you the most? After carefully studying these 7 solutions, you can see that each solution not only brings its own benefits but is also closely linked to each other to create a comprehensive care regimen for the motorhead. So, how to incorporate all these solutions into your daily life? Take your best shot, monitor results, and adjust as needed to maintain optimal fitness, especially as activity increases. Dear friends, we have just learned about the main issues related to arthritis, bursitis, rheumatoid arthritis, and patellofemoral pain syndrome. Each problem affects the ability to move and quality of life, but we also know there are simple solutions that can reduce pain, increase strength, and improve flexibility. Applying this solution does not help relieve headaches, but leaves an active, energetic life every day. To start, control your weight by eating properly and exercising lightly, then strengthen your muscles through exercises suitable for the elderly. Next, take time to stretch and make sure you always wear shoes that fit well and provide good support for each step you take. Finally, don't forget to supplement nutrients and use knee protectors when necessary to protect your health. Start today, because every healthy step you take is the key to a life of self-improvement. Remember, your health is your most valuable asset, and with small changes in your daily habits, you can take control and improve your quality of life. Let's move forward together so that every day that passes is a day of health, joy, and new hope.